WAM News Facebook page.
Airs
right on.
tonight, too.
Yeah, airs
6:30.
tonight. And we'll go into the Zoom room where we have, he's a member of the Physicians Advisory Group on the pediatric side of One Love Pediatrics, Dr. Michael joining the link now. Good morning, Doc.
Hey, morning, guys. Thanks for having me on again. That was
Always.
like a really nice tribute.
That was pretty cool. I'm glad you had front row seats for that in the Zoom room, right?
Where's your flute?
I did.
You got a flute? Do you play an instrument?
Yeah. Where is it?
No, see, okay, so I was messaging Dr. and I was like, okay, we're a few minutes behind because he had the 9:05 spot, so I was like, hey, if you want to no rushing. He was actually in there and he was like, man, this is amazing. He goes, I'm just gonna hang out and just watch, but
right, lurk a little bit. Maybe not the right
brought
word.
back a lot of memories, a lot of emotion. Oof.
Well, let's talk about it. Where were you on 9/11?
Oh man, I was a college sophomore waking up in my dorm room. I remember my girlfriend at the time gave me a call and said, there had been this incident. And I remember just being completely bewildered, right? I think a lot of people were. We thought it was an accident.
Right.
And I remember trudging off to my, organic chemistry class that morning at 8 o'clock. And we just watched it on the giant projector in our lecture hall. And everybody was just, you could just see mouths open. We had no idea what was going on. Right. And then, of course, that was the only storyline for the next, year, really. Several years after that.
Right.
And you're right, our lives just changed so much after that, all the things we had to do differently.
And in some ways, there's a similar parallel with this pandemic, although it's not a terrorism incident. It's an event that has significantly changed our lives, and I think will moving forward. So I
think you're absolutely right. The similarities are striking. And, I forgot the name of the gentleman who was speaking, but he was saying how, or was it Josh? He was saying how, we can't let the terrorists kind of split us and divide us. And honestly, I feel like coronavirus, at least, stateside mainland has been doing that almost better than what 9/11 could have done.
Crazy, right?
With all the division that we're seeing.
And we're starting to see it here in some ways. It's, not really something I want to see.
Yeah, a little bit.
Yeah. 9:20, Doc, let's go ahead and get right into it then. And we want to start here with Lillian Posadas. We had the hospital administrator on. She mentioned a spike in non-COVID pediatric admissions at the Guam Memorial Hospital. And I remember you had told me you had a pediatrics meeting. So can you shed a little more light on that?
Yeah, spike is a relative term, right? We didn't have very many pediatric patients in the ward in the first place. So I think currently there's about 4 peds inpatient, not counting the nursery, not counting the intermediate nursery. And so, the peds department, you may or may not remember, or the peds floor moved across the hall on the 4th floor to open up, and the old peds floor was opened up for COVID unit, the first COVID unit. And so the number of peds rooms we had left, I think we only had like 4 or 5 rooms, maybe 6 rooms left. And a couple of those rooms actually got absorbed to make room for more adult COVID patients. And so I think we have about 4 peds dedicated rooms left. And, a spike for us now would be, any number of patients.
Right.
And now we're going to have to look for more room. And I think, there's been talks, we knew this might have been coming. Typically the summer is a bit of a lull for pediatric hospital cases. But as we get closer to flu season and winter months, you typically see a spike. So most likely we'll probably have to move somewhere else down the hospital. I heard the rehab unit might be a possibility, but I haven't seen the space personally myself. And I was going to touch base today at the COVID GMH meeting later this afternoon to see where we're at with that.
Ooh, there's COVID GMH meetings?
There are now. We just have to start, there's just so many things that are changing. So they decided to have like a weekly kind of update to let everybody kind of know what's going on, get everybody on the same page.
And we know you're on the...
I was going to say, when did that start? This week?
This week?
Last week, maybe the week before, but yeah, I think we've only had one or two.
Who's part of that meeting?
Everybody that's involved in COVID, in the COVID response. So it doesn't even have to be clinicians, people who are, community physicians who are jumping in to kind of help, like, spread, say safety training or get some other information out. We're really looking for all hands on deck at this point. Really we're starting to reach out to community physicians. If they can help with the hospitalist service, that would be wonderful, fantastic. They really need the help. But even if they don't feel comfortable doing that, there are non-clinical duties that they can help with, or more academic side,
Right.
administrative side that they can help with too. So any physicians out there that would like to be involved, it's a really great way to see what's on the inner workings, because there's just so much information that spreads so quickly. They just can't have the time to update everybody every single day about everything that's going on unless they're kind of working within what's going on right now. So they could reach out to GMH and ask about that.
Doc, we know you're on the rotation at GMH, so we also heard from Lillian, 13 registered nurses out COVID-19 positive. As a doc on staff there, what's it like going to work every day and knowing that, man, the COVID has hit hard on both the medical side and the non-medical staff at the hospital?
Yeah, it's, you try not to focus on what we're missing out on, and you just try to push through. My last call night was, I think last week. So, I'm not in there every day. I think this week I have a call later this weekend. But, in front of just hearing from Dr. Julian Uggan, and she might be coming onto the show
Monday
later today.
Yeah.
But yeah, they're just exhausted. People are exhausted. They're working as hard as they can. The FEMA crew that showed up definitely helped relieve some of that pressure, give them a little bit of respite. But what can we do? We can't give up. You just got to keep showing up.
Yeah.
Hey, Doc, can you give us an update on the PAG meeting from last night?
Yes. So let's see. A couple of things. Overall, we didn't have any graphs. Felix didn't present any graphs yesterday, but overall, the trend seems to be showing that, the PCOR 1 declaration is working, but it is a much slower recovery this time around. The first time we went through PCOR 1, everybody was on high alert. There weren't very many cases, and we were pretty good about keeping cases down. And then now, as the virus has gone to a foothold into our community, it spread much faster than I think, we all thought it would when we opened up. And so, but what we're seeing now is, for the past, I think 7 days or so, the trend has been lower. Yes, I know there was a big cluster that was announced in the JIC last night, but excluding that, it seems to be trending down. The hospital admissions were plateauing, although Dr. Uggan was telling us that the patients that are coming in are very ill. So what it looks like is it's working. The thing is, it's kind of like a freight train, right? A freight train getting up to speed and then trying to slow that train down. PCOR 1 is like stomping the brakes, but it has a lot of inertia, and it's just going to keep going for a little bit. And so one thing is to really not let the community get discouraged that the numbers aren't falling as quickly as it did the first time, but our measures are indeed working. The other thing we discussed, the huge importance of getting the word out for everybody to get the flu shot this year. The hospital's already close to capacity, and even a small influx of flu patients, could really just be the thing that pushes us over the edge, and we can have like a little flu epidemic on top of the pandemic. So that could be really disastrous. I would really urge everyone to go out and see their doctors, get a flu shot. Let's see.
Did you guys talk about businesses? I know there was a protest yesterday again and again. Yeah.
Oh, yes. So yeah, slowly, we are PCOR 1 still, and we want to look ahead and start preparing for, if the trend continues, we could hopefully start thinking about, relaxing restrictions, or at least advising to the governor to relax restrictions whenever she's comfortable. So it was something that we started the discussion for. One thing, a lot of businesses really have, been trying to be responsible, try to do the right thing, allow social distancing in their businesses. And so it would be something nice to have those things open up. We didn't get into specifics about it yet. It was a little too early for that. Really, the talk was more about the hospital capacity. Staffing, always an issue for us. It's, that's one of the big things that limits us. And it's so hard to just throw money at staffing, right? We just can't throw money and have people show up. We need people to want to show up. And what we were hearing is GMH, despite all its efforts of reaching out to locums, reaching out for other staffing services, once people find out they're coming out here to do COVID, they don't really want to come out. So it's really hard to fill those roles.
And so, and just real quickly back on the businesses, you said you talked about it briefly, or the PAG did. Was it about this new sort of like classification where it's low risk, high risk? Because I know that the members of the business community were talking about engaging in those sorts of discussions to change it from the essential to non-essential to more of like a low risk, high risk, to determine what businesses can open.
Yeah, I think that's kind of the direction we want to go with. We were tasked with kind of taking some time to really think about what businesses we think could realistically provide a safe environment. And for most places that are extremely social by nature, most businesses are social by nature, where there's a lot of touching or really close contact, it seems reasonable. Of course, with these PAG meetings, things that I would think would be pretty simple. It really just shows why you need a diversity of opinions, because these discussions can be pretty lengthy and pretty intense sometimes.
Wow.
Yeah.
How intense? Like shouting match?
I wouldn't say shouting. Voices get raised sometimes, though.
What does that you say?
You can't be sensitive.
What
You can't be sensitive in these meetings.
What is that, Sabrina? You say I'm not shouting. What?
I'm just talking loudly.
Yeah, so it's talking loud.
When people ask me, "Are you yelling at me?" No, I'm just talking loudly. Yeah. Okay.
It's all done in a very respectful manner. Nobody takes it personally, I don't think.
You don't think?
We all leave with civility.
Doc, what about? Let me riddle me this, man. So we had a comment in here yesterday about hair salons, barbershops. What do you think? Your opinion?
My personal opinion, and I want to preface that we haven't discussed this specifically in the PAC, but my opinion, if everybody's wearing masks, with barbershops especially, right? If they're wearing masks and both parties are, I think the risk is relatively low. I want to say I read either a study or a report where several people went into like a hair salon place. This was, I think, someplace stateside, possibly abroad. And several people, like the majority of the patrons that went in, all caught COVID. But the people who didn't were the stylists, because they were all wearing their masks. And they weren't requiring their patrons to wear their masks.
Wow.
Just to be clear, this isn't in Guam.
Right.
And so if we could, wear masks, it's a little uncomfortable getting a haircut wearing a mask, I admit, but it could be a good way to do it. As far as we know, there hasn't been, or as far as I know, there hasn't been any outbreaks at the hair salons that I can recall readily.
Yeah. I was just asking for a friend. I got a friend whose his grays are really starting to grow out, and she wanted me to ask about the hair salons.
So when you guys
very
talk about what kind of guidelines or new guidelines and definitions on what businesses can open, are you guys even asking input from the businesses, or are we just relying on these doctors to come up with these new guidelines? Are you having the economic advisory group coming in?
We do have input from the businesses through the different members. So, just kind of like how I'm on the education subcommittee, there's other people talking to them. And then I'm sure, I'm one of the younger, maybe the youngest, and I've probably been on the island the least, but everybody else has a lot of connections, and I'm sure they're getting personal messages and calls and texts from the community. So
would you say that would you characterize these discussions as very much in the beginning phases?
Yeah, And yeah, I would say it's in the beginning phase for now. But we've had very similar discussions back when we were talking about, the first time we were on PCOR 1 about what to open up. So I imagine it's gonna, there's a few different things we have to think about this time around, and that the first time we were thinking about exiting PCOR 1, the hospital wasn't full, the cases were really low.
Right.
And now the one thing that's really hanging over the entire island, it's really an island crisis, that the hospitals are so, close to capacity. And that's really scary. If we open up and we turn out to be wrong about a certain business, or, something, and an outbreak happens, I would feel responsible. I would feel very responsible for saying, oh yeah, we totally thought that was going to be okay.
Right.
So we're, going to proceed with this, I'm sure, very cautiously.
Yeah. And you mentioned the education subcommittee. Are there still things being discussed in that subcommittee?
We just revived, we just had a meeting a couple nights ago to start thinking about the future. I think one of the things that's really getting to a lot of the public is it feels like we're going week to week, right, without a plan. Even though the plan is, let's see what the new evidence is showing up with the number of cases, et cetera, how the hospital's going, and then respond to that, which makes sense to me from a medical standpoint. But I can understand the public's kind of anxiety and frustration of not knowing what's going to happen 2 weeks from now, 3 weeks from now. And so the subcommittee met a couple of nights ago, just to, kickstart the idea of when assuming that things keep getting better, when can we start thinking about getting kids back in school? It's really just kind of a brainstorming session. And so, we'll hopefully have some more talks as things improve. Of course, we are in no way, shape, or form ready to open up schools at this moment.
Right. Yeah. But what can you do?
Something to start looking forward to.
Right. It's like, if you guys don't plan, we get mad. If you plan, we get mad. So just keep on moving forward. I like it.
Just take the information that we have and do the best that we can with it.
Hey, Doc, Jace here. I wanted to ask you a question, kind of like not completely tangential, but I've asked this question of some physicians I know that have been practicing medicine for 40, 50 years, and I'd like to pose the same question to you as like a younger doctor, right? Like,
sorry about my friend, Doc.
No.
They got him his own microphone.
But when you made the decision to go to medical school, to make the lifelong commitment to be a practitioner of medicine, right? I don't know if you wanted to say, I want to help kids that are hurting. I want to be the guy that solves cancer. I want to wear the nice white coat, or whatever your motivations are. Did you think at any point, but about the pandemic, did you ever consider that you would have some sort of position like this, where you were making these decisions and thinking of all the different things that you have to think of as a physician with coronavirus?
I thought, to say that I would have expected something like this, never, really. But my motivations for going to med school in the first place was to eventually work in a place that was, someplace relatively underserved,
right.
And really try to make a difference in my community. And so, as a clinician, when coronavirus hit, I was actually thinking to myself, hey, this is why I went to med school. Like, I'm going to be showing up to clinic. I'm going to be seeing sick patients. I'm going to be counseling my patients. And, we're going to get through this. I didn't see myself being named to any, advisory committee, or, having to make higher level decisions, or being a part of a group that makes higher level decisions. And, I've, treated it as like a, really big privilege and a really big responsibility, and really just doing it out of a sense of duty. This has been going on now for, we had our first PAG meeting back in middle of March, right. And we used to have meetings 3 times a week. We're down to twice a week now. We have to cut time out of our clinic, to go to this. And, it's not just the PAG, I have to be involved with, because of my role in the PAG, it also involves a little bit more with GMH stuff.
Right.
Also my role as a hospitalist. So it all just kind of interlinks. And I gotta say, it's stuff that I think a lot of doctors, this is what we train for. Mm-hmm. And I would really hope that we all stepped up.
Yeah, just to close out my question, Doc, because that's the reason I was asking, because the only thing that I can liken my own experience with is, like, as a computer scientist, I look back to the Y2K bug.
What?
in 2000, right? And I remember myself and like a
I
lot of our
remember that.
colleagues were like, we're not trained for this. We didn't think that we were gonna have to, do that. But the sentiment that you shared is kind of like very similar with a lot of physicians at different levels in their career, and they were like, you know what? There's a lot of things that I never thought I was going to do, but this is why I got into the profession, and this is my calling.
Doc,
Yeah, I mean, I wish we could have been trained for something like this, but we just got to do the best that we can with the information that we have.
right, and I think a lot of us, this is some pretty killer on-the-job training for, I mean, even us in the media, we didn't think that we were going to be going months. I mean, it's September 11th.
Here we are.
I want to kind of key into something you said about Guam being an underserved. We have that designation, right? And you said that you went to school because you wanted to come to a place like Guam. So could you kind of go into a little bit more, maybe for people out there who don't know what that designation means for our island? Because I think it's key in that that's why we're so careful about the hospitalizations being full, because already before COVID, I mean, we were back down on the canvas.
Right. So yes, I mean, by function of how far we are from stateside, and just a relatively small population, our population is a little too small to support many of the specialties that we need on island, because those specialists just would not see enough of their type of patient. So for example, we used to have a pediatric cardiologist that was on island. I don't know if you guys remember, it was a couple years ago. And he came in because his wife was an intensivist. Great, we needed an intensivist. But he was out here and he barely had any pediatric cardiology patients. And he was pretty relatively new at training, and he was just seeing his, he was just not doing what he was trained for. So he ended up, they ended up moving back. And that's just a really easy example of how we're underserved. In addition to that, Guam's population is about 160, 170 civilian, right? And I remember a while back, I was comparing it to my hometown of Santa Barbara, just for pediatricians, the number of pediatricians we have. Santa Barbara has a population about maybe 130 if you count this neighboring city. And Santa Barbara has about 60 pediatricians when I just looked online. Compared to Guam, we have a dozen, right? So, easy stuff like that, we just can't, get enough providers for. I think when I showed up, or when my wife and I showed up, we were the first new pediatricians in 5 years. And I don't think we've had a permanent pediatrician since then. I know we've had, people who come through Navy, SDA, thankfully brings people through, but they typically don't stay permanently. And so, that's just kind of the nature of living, on an island paradise. So sometimes you're on an island.
So Doc, I have a question completely different from these two, and and my question really is about children. And so we have a lot of kids that are at home, they're on their computers, with online learning, and so they're not really outside and exercising because they're on the computer all day. So maybe just some advice for parents. To ensure that our kids are staying healthy
And their brains aren't getting rotten.
Well, I think an educator would probably be the best person to speak about this. But yeah, you're absolutely right. I think I hear a lot of frustration from the parents that show up in clinics saying that the online homeschooling is just really, really difficult for them. And it's, they just get so much screen time. What can you do? But they say it's for school. The thing I would say is, try to decrease the extra screen time, right? So if you're in class, of course, you're gonna have to show up and be on their Zoom meetings and Zoom classes. But when they're not in school, try to turn it down, turn off the screens, get outside a little bit if they have a safe space to do so. One of the things that we're seeing is that the weight of my patients have just been, it's just been going up really steeply. And for
so
COVID,
kids are getting they're eating too much snacks, they're getting fat.
Right. And one of the things we're seeing is that obesity is turning into a huge risk factor for having a severe case of COVID. And I'm sure you're seeing that in the news. We're seeing it just anecdotally with cases on our island. And so, you know, as part of, COVID, preparation or prevention, I would definitely recommend the bare minimum would be 30 minutes of just, moderate activity for children every day. And more if they can do that.
Why is obesity one of the things that makes people more susceptible to having a bad case of COVID?
I think we touched on this maybe like 6 weeks ago during our first interview, and my guess back then was that, they can have like some chronic inflammation going on, some metabolic syndrome. There's actually some research that's coming out, and I think one of the things they're touching upon is a bit of a decreased immune response. I can see if there's anything new out there to give you a more definitive answer.
Sorry, Doc, I can't remember 6 minutes ago, let alone 6 weeks back.
Yeah, I mean, six minutes, 6 weeks. It seems like this thing is lasting like 6 years.
Right. I mean, we talked about the spike again in the pediatric admissions, but what types of things are you seeing at the clinic level with the kids?
Really, not anything really out of the ordinary. I haven't really been seeing too many upper respiratory illnesses yet. We've been calling people back in for flu shots, a lot of well child visits, and then just the kind of random, little skin infections, maybe some eczema flare-ups, and nothing too serious yet. I think in the hospital, it's typically in the winter season, we'll all of a sudden start to see just this one of three respiratory the conditions over and over and over again, right? We'll see asthma over and over, we'll see pneumonia, and we'll see bronchiolitis for the smaller babies, but we haven't seen that quite yet. And so part of that is I'm sure, due to us isolating and keeping ourselves distance and then wearing masks, really reducing the transmission. And two, flu hasn't quite hit super hard yet, although it's been showing up in GMH from what I'm hearing.
We've seen some, increases in children who are getting COVID, right? And I think I want to say in one of the JIC reports there was 2 positive cases that you guys ran results for, right?
Oh yes. Oh, in our clinic, those were not children, however.
Okay.
But the children I have seen with COVID, they look remarkably well. I mean, you would just not think they had COVID, but it's really, I'm so grateful for that. I know I say that every time, but I'm so grateful that the kids are doing okay in general.
What's the youngest child you've seen?
The youngest that I've heard or that I've seen.
Either one.
I think there's oh shoot, I don't want to break
You break it.
well, I'll say infant.
Infant.
Yeah.
Well, I think that's what.
And they did well too.
Right. Doc, we get this question a lot. Treatment when you have the coronavirus, and obviously this is for the people who maybe aren't hospitalized, some of the milder cases. What are the kids and people with COVID taking?
You mean once they're hospitalized?
No, that are at home and they're recovering.
Oh, that are at home? I mean, it's just supportive care. So, get them a lot of fluids, let them rest up. You can treat the aches and chills and low grade or fevers symptomatically. So Tylenol. I know there's been some way back, there's some talk about Advil making things worse. That doesn't seem to be really playing out. But if parents wanted to be, extra careful just in case, I told them, okay, it's okay to just use Tylenol. I use Advil just for full disclosure.
Right.
And I thought it was fine, but just supportive care for now.
Can you also talk about when those patients are hospitalized? What type of treatment do they receive?
I think Dr. Uggan would probably be the best to tell that, but in general, we found that definitely it's supportive care, right? So you got to give them their oxygen support. There's a thing called proning that seems to be helping a little bit. Typically when you go to the hospital, people are lying on their back. It's we're lying supine. Right. And then the thing that they're doing now is they're laying on their tummy. and that's kind of helping open up and aerate their lungs a little bit. Wow. Steroids have been shown to be helpful, so I'm sure they're getting steroids. And then remdesivir, the antiviral that made kind of a big splash a while back. You know, the U.S. bought up I think almost nearly the entire global supply, and then started dishing it out. You know, due to our small population, we didn't get very many doses. And I think the last time I heard, and you can definitely check this with Dr. Again, right. We only have enough courses for maybe less than 10 courses of remdesivir on island. So, you know, it's very, very concerning, very worrisome.
Well, that's something we'll definitely follow up on. Doc, in closing, anything to say to parents, kids, people of Guam?
Keep doing what you guys are doing. It is working. I wish we could see the results faster, but it does seem to be working. And please, please, please get your flu shots. Please get your flu shots. We can't have a second epidemic on top of this.
Right. And you guys have it there at One Love, right?
We do. We'd have it on One Love. I know. I heard AMC got their shipments early as well. I know a lot of people think every time they get the flu shot, I always get sick. The earlier you get it in the season, the less likely that's going to happen, because typically when people get the shot, they wait until everybody around them is sick. They're like, oh, I guess I should get my flu shot. But it's an inactivated antigen, and so there's nothing in there that can actively get you sick. Usually it's just the timing of the virus that they picked up.
Right. Okay. Right on. Thank you, Doc.
All right. Thanks, guys.
Stay safe.
Good talk. Stay safe. Have a good weekend.
Stay safe. Have a good weekend.
You
Thanks.
see you, Dr. Michael Amma. One Love. You got to say it like that, right? Pediatrics 949. Hey, we're going to take a